Hello viewers and welcome to my channel. In this video, I want us to discuss about Bell's palsy. Now, what is Bell's palsy? What are the causes of Bell's palsy? How does the condition present clinically? And how do we diagnose and treat this condition? Now, Bell's palsy is a condition that occurs as a result of cranial nerve 7, either it has been compressed or any damage to the cranial nerve 7 can lead to Bell's palsy. Now, what is this cranial nerve? What is this cranial nerve? This cranial nerve 7 or the facial nerve innervates the muscle of the facial muscles of expression, that is the muscles that we use to smile or make different facial expressions. It also innervates anterior to that of our tongue, which helps in tasting. Also, it innervates the lacrimal glands, playing role in secretion of tears. It also innervates the sublingual and submandibular glands, which secrete saliva. And finally, it also innervates our ears, so it has a role in the hearing process. Now, Bell's palsy is an idiopathic condition, meaning that the exact cause is not well known. However, we have various causes that are associated with Bell's palsy, and the most common one are the viral infection. We have viruses like the COVID-19, the virus that causes COVID-19. It is the most recent one. Other viruses include the herpes simplex virus type 1. We also have the varicella zoster, or the virus that is associated with shingles. We also have HIV, Epstein-Barr virus, and cytomegalovirus. It is also associated with causing Bell's palsy. We also have other causes like vaccination. Vaccination has also been implicated in causing Bell's palsy. We also have some bacterial infection, although not so common, like viral infection in causing that are normally associated with Bell's palsy. Now, how does this patient present clinically? Now, like I've said, cranial nerve 7 or the facial nerve, it innervates different parts. We have talked about the facial muscles of expression, meaning that the side which is affected, it will be pulled toward the opposite side. So we are going to have a division of the mouth towards the unaffected side. And that tells you that Bell's palsy mostly occur unilaterally, but it can also affect both sides, but very rare. The other clinical manifestation is that this patient will complain of loss of sense of taste, because we say that it innervates the cranial nerve 7 innervates the anterior to that of the tongue, and this plays role in the sense of tasting. They will also have issues with the secretion of tears. Either they will have excessive secretion of tears, or they will have reduced secretion of tears. They also have reduced secretion of saliva, because we say that it innervates the sublingual and the submandibular salivary glands. The other thing, the patient may complain of not hearing well, because we have said it also innervates the ears, and it plays a role in the process of hearing. Now, how do we make diagnosis of this condition? Diagnosis of Bell's palsy is usually clinical. However, in some instances, we may also want to do imaging, and in this case, we do electroneurography. This will help us to see the amount of, or the level of damage that has been done to the cranial nerve 7. and it plays a role in prognosis or in the process of management. However, diagnosis is mainly clinical, and we refer to this as diagnosis of exclusion, meaning that we are going to rule out all the other causes of facial paralysis, including stroke and other conditions, before we arrive at Bell's palsy as the diagnosis. Now, how do we manage this condition? Uh, it is important to note that Bell's palsy is a condition that in most cases, in most patients, about 90% of the patient, the condition will heal it will heal without any intervention. The patient usually recovers, they don't need any medical intervention. However, in some cases, we do prescribe steroids, glucocorticoids, the steroids. This is just to help and minimize inflammation of the nerve. The other management that can also be applied in case based on the results of the electroneurography. Remember, we say that we want to assess how much of the cranial nerve 7 is damaged. If the nerve, if more than 90% of the cranial nerve is damaged, in that case, you can, or the patient can be recommended for surgery. Well, that is all about Bell's palsy. What causes Bell's palsy, how the patient presents clinically, and how we make diagnosis plus treatment. I hope you have learned something, and if you have any question on Bell's palsy, you can ask under the comment section. Please do not forget to like and share my video. Well, thank you and goodbye.